Is Parkinson's disease curable? What you need to know. Parkinson's disease is a neurological disorder that affects millions of people around the world. If you or a loved one has been diagnosed with Parkinson's, you might be asking the same question many others have. Is it curable? The truth is, there is no simple answer. While there's no definitive cure for Parkinson's disease at this moment, recent breakthroughs in research and medical treatments have shown great promise. If you want to learn more about this disease, what it means for your health, and how you can manage it, then keep watching. Understanding Parkinson's and the options available to you can make all the difference in how you live with it. So, let's start with what Parkinson's disease actually is. Parkinson's is a condition that affects the brain and makes it harder for people to control their movements. It's a progressive disease, which means it gets worse over time. The problem occurs when nerve cells in the brain, which are responsible for producing dopamine, a chemical that helps control muscle movement, begin to break down. Dopamine is essential for smooth and controlled movements, so as these cells die off, symptoms like shaking, stiffness, slowness of movement, and balance problems start to appear. In the early stages, these symptoms can be mild, and some people may not even notice them right away. But as the disease progresses, they can become more noticeable and interfere with everyday tasks. Things that we usually take for granted, like walking, getting dressed, or eating, can become more difficult. It's a tough condition to manage, but with the right treatments and support, people can still live fulfilling lives. Now, you're probably wondering, is there a cure for Parkinson's disease? Well, right now, the answer is no. Unfortunately, there is no cure. That said, just because there isn't a cure yet, it doesn't mean there's no hope. There are several treatments available that can help manage symptoms and make life a lot easier for people living with Parkinson's. One of the most common treatments is medication, particularly a drug called levodopa. This medication helps increase dopamine levels in the brain, which can help reduce symptoms like tremors and muscle stiffness. It doesn't stop the disease from progressing, but it can significantly improve quality of life for people living with it. Aside from medication, therapies like physical therapy, speech therapy, and occupational therapy are incredibly important. Physical therapy helps with movement and balance, speech therapy helps with communication, and occupational therapy assists with making daily tasks easier. So, while Parkinson's can't be cured right now, there's a lot that can be done to manage it and keep people as comfortable and independent as possible. The good news is that research into Parkinson's disease is moving forward at a fast pace, and scientists are working hard to find new treatments, and hopefully, a cure. While there's no definitive cure yet, there are some exciting advances happening in the world of Parkinson's research. One area that's generating a lot of buzz is stem cell therapy. Scientists are exploring how stem cells might be able to replace the damaged brain cells that cause Parkinson's. The hope is that by transplanting healthy stem cells into the brain, they can help restore the dopamine-producing cells and improve symptoms. It's still in the early stages, but the potential is huge. Another area that's being studied is gene therapy. This treatment involves delivering specific genes to the brain to boost dopamine production, potentially slowing down or even reversing some of the damage caused by the disease. Like stem cell therapy, gene therapy is still being tested, but early results look promising. And it's not just medical treatments that are being explored. Lifestyle changes like eating a healthy diet, staying active, and keeping the brain stimulated are all being looked at as ways to help slow the progression of Parkinson's. Regular exercise, for example, has been shown to improve balance and mobility, while activities that challenge the brain, like learning new skills or doing puzzles, could help improve cognitive function. While we don't have a cure yet, all these advancements in research give us hope that the future could look brighter for those living with Parkinson's. The more we learn about the disease, the closer we get to finding effective treatments and, hopefully, a cure one day. Now, let's talk about how you can manage Parkinson's disease and continue living a fulfilling life, despite the challenges it may bring. While Parkinson's disease might not be curable right now, it's important to know that you can still live a meaningful and fulfilling life with the condition. Managing Parkinson's effectively is all about making small, manageable changes to daily routines, staying active, and taking care of both your body and mind. Let's dive into some tips that can really help make a difference. One of the most crucial things for anyone living with Parkinson's is physical activity. Regular exercise doesn't just help improve your strength, it also plays a big role in improving balance, flexibility, and mobility. It may sound like a lot of work, but the benefits are well worth it. Many people with Parkinson's find that aerobic exercises, like walking, cycling, or swimming, help reduce symptoms significantly. Stretching and strength training exercises can also go a long way in easing muscle stiffness and improving overall movement. In fact, some people even find that starting their day with a bit of stretching can help them feel less rigid and more energized throughout the day. But it's not all about physical movement. Mindfulness and relaxation techniques are just as important when it comes to managing Parkinson's. Living with a chronic condition can bring up a lot of emotional challenges, and feelings of stress or anxiety are common. That's where things like meditation, deep breathing exercises, and even yoga can be helpful. Yoga, in particular, has been shown to improve both mental and physical health by calming the mind and increasing flexibility. And it's not just for relaxation. Regular practice can actually help you with better posture, balance, and even coordination, which are areas that Parkinson's can affect. Another essential aspect of managing Parkinson's is staying connected with your healthcare team. Parkinson's can be a tricky condition to navigate because it requires ongoing care and attention. Regular checkups with doctors, neurologists, and therapists ensure that your treatment plan is working for you. They can also adjust medications and therapies as needed to address new or changing symptoms. It's really important to be proactive in monitoring your health and discussing any concerns with your healthcare team so you can stay on top of managing the disease effectively. Living with Parkinson's means making adjustments, but with the right strategies, it's possible to maintain a good quality of life and enjoy daily activities with confidence and independence. Living with Parkinson's disease can be a challenging journey, but it's important to remember that you're not alone. With the right approach, support, and lifestyle adjustments, it's possible to manage the symptoms and continue leading a fulfilling life. By staying physically active, mentally engaged, and maintaining strong connections with loved ones and healthcare providers, you can enhance your quality of life every day. Research continues to bring hope for new treatments and breakthroughs, so always stay optimistic about the future. If you or someone you know is living with Parkinson's, remember that there are resources, therapies, and communities available to help. Take it one day at a time, stay informed, and never hesitate to seek the support you deserve. Your journey with Parkinson's doesn't have to define you. Your strength, resilience, and the people around you will always be what truly matters. If you found this video helpful, make sure to like, share, and subscribe for more valuable insights on health and well-being. Take care, and we'll see you in the next video. Thank you for watching. Stay strong, and take care of yourself.